Nutrition is a really important part of a healthy and happier perimenopause and menopause. This is because the way that we metabolize food and our gut microbiome goes through some fundamental shifts at this time of life. Nutrition can especially reduce the risk of chronic diseases associated with a poor diet, which we see an increase of in women post-menopause. These are things like heart disease, type 2 diabetes, and obesity. So nutrition is not only important to help women feel better day to day as they go through the changes and the symptoms of menopause, but also in ensuring that their long-term health is protected against some of these increased risks. Interestingly, at Zoe, we've done some research to show how dietary change and supporting a healthy dietary pattern can actually reduce the symptom burden for menopausal women. This research is available to see on the Zoe website, and it actually shows that as women change their diets towards a healthier plant-based diet, they can reduce their symptom impact by about 34%. So it's a considerable change, and this is true for women both taking HRT and not taking HRT. So nutrition is a piece of the puzzle that helps women at this phase of life, regardless of the other interventions we're putting in place to help support them. So the foods that we know help with menopause are fibre-rich leafy greens, fibre-rich plants in general, legumes, seeds and nuts, whether you're enjoying whole grains in your diet, fruits and vegetables. It's really important that women in menopause review their diet and try to increase the amount of plant foods they're eating and the amount of fibre that they're eating. The majority of the UK population do not reach the minimum dietary recommendation of 30 grams per day. So really making an effort to include foods like lentils and beans, whole grains, leafy greens, fruits, vegetables, nuts and seeds is imperative at this time of life. Also, there's really good evidence to support that foods containing phytoestrogens, so soy products, can really help to decrease the severity of symptoms. This is likely because these phytoestrogens actually bind with estrogen receptors and help to mitigate some of the negative effects of a lower estrogen. So including things like tofu, soy milk, edamame beans can really support our transition. And this we can see from other populations in the world that have a high soy intake. They tend to have lower symptom burden. The other thing to really consider at this time of life is your alcohol intake. Reducing alcohol intake massively improves symptom burden, and it's better for our long-term health anyway. So making sure that we're not drinking more than maybe 1 to 2 glasses per week is a good tactic. So in the menopause, we start to look at and be aware of our muscle mass, because we know that having good muscle mass improves our metabolic health and our functional ability to remain independent in later life. It's also true that women do tend to lose muscle mass as they get older, and so we do need to pay attention to our protein intake and to making sure we're moving our bodies functionally and strengthening our bones and muscles through regular physical activity. But how much protein do we actually need for this? Well, the WHO recommends about 0.81 grams per kilograms of body weight of protein, and some suggest that for menopausal women this might go up to 1 gram per kilogram of body weight. Now, I really want to be clear that it's very easy to achieve that if you're eating a whole food diet. There is very little, if any, protein deficiency in the UK from women who eat enough food. So if you're undernourished and underweight, then it could be an issue. But if you're eating enough food, this is not something to worry about. And I don't recommend taking protein supplements to help you reach a goal that's higher than 1 gram per kilogram per day. Instead, focus on healthy protein and fibre-rich foods, including lentils, beans, nuts and seeds, and things like tofu, especially if it's calcium-set tofu, to add to your protein intake daily. Of course, eating eggs and oily fish and meat can be part of a healthy diet, but actually focusing on your plant protein intake is what's known to be more helpful for long-term health and reducing the risk of chronic disease. There is no one fad diet that's going to help women through the menopause. It's really about following a healthy dietary pattern that's going to support them through the menopause transition and beyond. The key principles of a healthy dietary pattern that will support women is essentially to have a high quality, whole plant-based diet that includes vegetables, pulses, nuts and seeds, fruits, as well as some high quality omega-3 containing oily fish, some eggs, and some other higher quality protein from animal sources. The most well-researched healthy dietary pattern is the Mediterranean diet, and you can find resources to follow the Mediterranean diet online. It's very simple, it's highly researched, and we know that it reduces the risk of chronic diseases for both mental and physical health outcomes. It also aligns with the diet that we looked at with the Zoe Menopause studies, where we looked at how women following a high quality diet, similar to the Mediterranean dietary pattern, had reduced symptom burden when they switched to this diet. So it's not about following a specific diet that's been written in a book or a celebrity influencer. It's really about going back to the basics of what we know to be true for a healthy dietary pattern throughout life. There is no evidence that any multivitamin supplement is going to be helpful in the menopause specifically, and there are a variety of supplements on the market at the moment that are specifically targeted and aimed at menopausal women that do not have the evidence to back them or their price tag up. If you are going through menopause and you're worried about having some nutrient deficiencies, or you feel that some things could help, please speak to your doctor. The only thing that has some evidence is isoflavones. So these phytoestrogens that we've been talking about, you can get those in a supplement form, and they do seem to have a positive impact. But otherwise, I don't recommend taking any supplements outside of your doctor's recommendations, and I would actually steer clear of anything that's specifically aimed at menopausal women that has a higher price tag for no real reason. Bone health is a big topic for menopausal women, and so calcium and intake of calcium becomes front of mind. Now, it's really important to remember that calcium supplementation can actually be harmful for heart health, so please don't supplement with it. But make sure you're getting plenty of calcium-rich foods in your diet. Now, luckily, this includes dairy like yogurt and cheese and milk, but it also includes all the leafy greens, plenty of nuts and seeds, and some legumes. So if you're having this variety of fiber-rich plant-based diet, you will get calcium from a variety of sources. Not to forget things like sardines and anchovies, which contain lots of calcium because you eat the bones. Our Zoe Predict Menopause study that was published in The Lancet in 2022 clearly showed that menopausal women had a different gut microbiome signature to premenopausal women. So something is fundamentally changing in our microbiome, in our gut microbiome at this time. How can we support this change towards a healthier, happier gut microbiome and away from a pro-inflammatory gut microbiome profile? Now, probiotics have not been shown to be able to do this yet. There is some evidence to support that there are specific strains or specific brands of probiotics that can be helpful for health outcomes such as diarrhea, constipation, or when taking antibiotics. But as a general rule, we're best off getting these healthy, happy microbes from fermented foods like kefir, like yogurt, like kimchi and sauerkraut, and adding a little bit of miso to your cooking. Now, if you are somebody who isn't used to eating these probiotic-rich fermented foods, or you are taking antibiotics, or you're worried that your gut health has suffered for perhaps a course of antibiotics or a medical treatment, there are certain brands that are evidence-based in terms of probiotics. I personally think Simprove has done some good clinical trials to support their product, and Optibac have some good single strain and female health formulations that are quite accessible in price and could be helpful. The menopause brings with it many changes, and this also includes digestive issues. So many women going through menopause will report that their ability to digest certain foods changes, their tolerance to certain foods, including alcohol, changes, and their gut can change in terms of its transit time. So constipation can be quite common, but so can random bouts of diarrhea. So how can we help women to manage these gastric symptoms, which can fluctuate with hormone fluctuation? So they can be quite unpredictable. Well, in all cases, eating plenty of fibre can really help to mitigate the negative impacts, but also understanding which foods are having more of an effect in terms of gastric symptoms can be really helpful. Keeping a food diary, or simply observing the days where you feel better in yourself, and always being kind to yourself, knowing that restrictive dieting isn't going to help in the long term. So it's really about finding the combinations of food that work for you. A really simple tip is to cook your vegetables if you feel like you're getting a lot of bloating and gas and your gut is still adapting to the changes. Cook your vegetables instead of eating them raw. It's just slightly easier to digest. And when your gut settles again, you can reintroduce some of the raw vegetables. This also applies to how much fibre you eat. If you're trying to increase your fibre intake and you do it too quickly, it can cause gastric symptoms. So introduce fibre-rich foods like lentils and nuts and seeds and beans gradually. And once you get used to, say, 1 tablespoon, you can go up to 2 tablespoons, and so on and so forth until you can enjoy a whole 3-bean stew. In terms of foods to avoid, previously people thought that eating phytoestrogen-containing foods could be negatively impacting women who had breast cancer or who had survived breast cancer. The evidence is clear now that this is not the case. So I want to be really clear that phytoestrogen-containing foods like soy and edamame and other soy products are completely safe and beneficial to eat. The things we should really be avoiding at this time of life are ultra-processed foods and highly refined carbohydrates. So these are things like pastries, cupcakes, biscuits, crackers, things that don't contribute to our fibre intake and that tend to have a high sugar content. Important to avoid these foods as much as possible without being too strict in terms of perfection. It's really about getting to a place where the majority of your food is whole food, unprocessed if possible, giving yourself that 20% of leeway for things that you might just feel like eating or that come your way at a party or when you're at work. Reducing ultra-processed food consumption is associated with a reduced risk in many chronic diseases. And when we're going through this phase, this transition in life, it's important to support our metabolism as much as we can. So where possible, choose whole foods that are from plants, rich in fibre and polyphenols, which are the colourful chemicals that reduce inflammation. Choose phytoestrogen containing compounds like tofu and edamame and soy milk, and try to avoid things like white bread, white rice, pastries, and other highly refined carbohydrates that can contribute a lot of sugar but not much in terms of nutrition.